Hey guys, Steven Sanfilippo here. Today we're going to go over an EMS topic. I'm going to show you guys how to use the LifePak 12 to pace a patient who is in bradycardia. Okay. First off, anytime we do patient care or handle any medical equipment, we like to make sure we have on the appropriate PPE, so we're going to use gloves at minimum. Okay, so we got our gloves on for our personal protection. Now, when we make patient contact, we get basic history, basic situation on what's going on at the time. Okay, so we get them on the stretcher and in the truck, and we're going to take basic vitals. So, patient not feeling well, weak or dizzy, we're going to go ahead and take their blood pressure immediately. Also in here we have our limb leads, and our limb leads are going to be connected to their arms and legs to show us a basic rhythm of the heart. In doing this step alone, we're going to be able to tell the patient's blood pressure. In a Brady situation, there's a good chance it's going to be hypotensive. It's going to be low blood pressure. So with the hypotension and the Brady rhythm that we now see off the limb leads, we know that we have to perform an intervention in order to bring the rate up, help the blood pressure, maybe chest pain. So from there, what we're going to do is we're going to open up this side, and we have our quick combo pads. These are going to serve as our pacer pads. So the pacer pads go onto the patient on the right side of the upper chest and on the left side, left lateral side of the patient's torso. This will deliver the electric shock through the heart in order to stimulate a contraction. Okay, so I'll also pay attention because there are images on the quick combo pads as far as placement, so that way you will not place them in the wrong position. Okay, so after the quick combo pads are connected, we will consider sedating the patient if they are completely with it, just for their comfort. Okay. Next thing we want to do on this LifePak 12 is go ahead and select the pacer setting. Okay, after we select the pacer setting, the next step is to adjust the rate. Many people use the Brady 80 saying. It's just an easy way to remember, what rate you want the heart rate to be at. Some departments, and depending on your protocols, it will be a different rate to start to initially get the patient up to. So always refer to your protocols that your department uses before pacing. So we're going to set the rate to the appropriate setting. After the rate is set, we're going to adjust the current. Now there's two ways of doing that. You can adjust the current using the button here, pressing the button once at a time, slowly increasing the rate, or you can use the dial down here by twisting it and slowly increasing the rate. Now you're going to increase the rate until you see electrical capture. The electrical capture is going to show a contraction of the heart on the monitor, which is great, but we want to go ahead and check for mechanical capture, meaning check a pulse. We want to make sure that the pulse is matching up with the rhythm we see on the monitor. So we're going to manually check, count the heart rate, and if it matches up with the monitor, then we're good. In some instances, it's always good to go up another half a point here, and then you press the dial here, hear it click, to lock it in place. For long transport situations, there is a pause button here, so if the patient appears to be in a better status, you're able to pause the pacing using the pause button and check to see if the heart has taken over at that rate. If not, it's always important to maintain the pacing until you arrive at the medical facility. And that was a quick 101 on pacing using the LifePak 12. I hope you guys enjoyed, and I'll talk to you soon. Thank you.